Hi, Taya Countryman here again. Bob again. So, if you watched my vastus lateralis and medialis YouTube video, you'll know that I had my hands on his upper leg. And while we were doing that, Bob started whining about his hip. He talks about it being stiff. It doesn't hurt to lay on it, but he doesn't like in any one position for very long. So I thought, hey, let's take a look and see what's going on. So there are some tender points right near the head of the femur, but when I look at his leg and I compare it to the other leg, look at where his foot is. Look how turned out his leg is. Oh, so that's another tender point that we're going to look at. But let me check the tender points right at his hip. I'm going to use my hand to come up the IT band and come to the top of the femur, and I'm just going to see generally if I feel tightness, and I do. So we're probably going to be treating 3 tender points today on Bob's hip. So Bob, what I'm going to need to have you do for me is you're going to be laying on your left side, and I want you to do that comfortably. Okay, so can you lay on your left side? And then I'm going to have you come closer to me. So back up, a little closer, a little more, till you feel me. What's really great about this Veneto table is I can get him close to the end, and I don't have to worry about this table flipping up and hurting me or hurting Bob. So you can put a lot of weight on this table, and you know you can be secure. So let's just stack your knees for me. And are you comfortable here? Do you need another pillow? Are you okay?
No, I'm fine.
Okay. Again, I'm going to come up his IT band, and right here I'm going to feel where the top of the femur is. And if they're healthy enough, lift your leg up a little bit for me. You can feel right where it is in that little divot. You can put that down again. Let's see if he has a tender point here. Tender there, Bob? A little bit. I'm going to change my angle. It's a little more tender there.
Yes.
Right there. Ooh, that one gave us a nice little tender spot. So I'm going to mark that spot, not putting any pressure, and I'm going to scoop in right here into his leg. See how Bob wants to help me? It's okay to let him help you when you first do it. So I'm going to abduct and extend his leg right to where it stops. Now, if I have my hip against his backside, if I don't, he would roll off that hip. So I'm just stabilizing it. And now I'm going to test it. Better, same, worse, or gone, Bob, but not gone. Now that he's been here a little bit, I bet I can get a little bit more extension and a little bit more abduction. Better, same, worse, or gone. Okay. And you've let go of your leg and it's nice and heavy in my hand. That's good because, of course, your patient wants to help you. I can take this hand off because the position is making that tender point go away. That's what SRT is all about. And I'm going to bring my other hand around here so that I'm comfortable. And we're going to hold this for 90 seconds. Okay, now that we have 90 seconds gone, I'm going to bring him out very slowly. And you know what was pretty amazing just then? I could feel a little click in his hip. This really helps to reset the hip. And I said it was the head of the femur, but it's really the top of the trochanter. So I got to be good. I got to use the right words because I'm on YouTube. But now where I was before feels softer, and that's a great reward. That's the lower hip point. Now let's feel a little higher and see if he has an upper point here. Is that tender in there at all?
A little bit.
Is it more tender a little higher?
Yes.
Okay. How about there? Is that worse? No. This one here was the worst one right there. This one's a little different than the other position. And so I'm going to flex his knee, see where I'm gripping on the outside, and I'm going to bring him straight up. Again, I'm using my body to support him so he doesn't fall off his hip, and I'm going to test it. Better, same, worse, or gone. Get a little bit more extension. Better, same, worse, or gone. And I'm going to use both hands to hold this position for 90 seconds. You can see today that what we have Bob in is some shorts. Some of these positions can be awkward for draping. So oftentimes when I see a patient that I know has this problem, I have them wear some athletic shorts or bicycle shorts that are stretchy so that we can do these positions without having to worry about draping. But trust me, in the old days, I did drape correctly whenever I did these positions. So we probably have about 30 seconds gone, so we're just going to hold it for another minute. So after our 90 seconds, we want to bring him down slowly. And now we're looking for our reward. And oh, look how much softer he is there. Now both of those positions can be difficult to hold, so make sure you get your patient engaged. Check in with them to make sure that you aren't releasing your pressure or you're pulling more on the leg so that they are comfortable and they can help you hold the position much more steady. Now let's have Bob turn to his back. So now that we have Bob on his back, what we did not change this whole leg that turns out. And the secret muscle that does that is not the piriformis like we usually have been taught. It's really the gluteus minimus. And let's review. It's deep to the gluteus maximus, right off the midline, and it wraps around to the front on the greater trochanter. It's that muscle that keeps your hip from popping out, and it's the one they cut through usually when they do a hip replacement. So you can feel the tissue. I can actually just reach in and feel that small glute and feel how tight it is. But the tender point is where it wraps around on the greater trochanter. So now let's try and find it. So I'm going to put my hand, follow the quad up and feel right here at the top of the quad. And what I'm going to do is move his leg back and forth so I can feel that trochanter come up and I can feel where it's tight. And then I'm going to test it. Is it tender there? Yes. Is it more tender if I move up? No. Yes. It is. How about there? Oh, I love that look on his face. So we know that's tender. But I'm going to need to be on the opposite side of the table to actually treat this. So I'm going to get Bob involved. Bob, can you take your finger and just put it right there? Don't put any pressure because he's going to mark that spot for me. And I'm going around the other side of the table. Bob, can you come a little bit closer to me? Good, that's great. Right in the middle of the table, I'm going to reach across. Thank you for holding the spot. And I'm going to find that tender spot. Tender? Ooh, I love that look. I'm going to grab on the outside of his leg. I'm going to reach up, bring him across, and I'm going to test that point. Better, same, worse, or gone? Better. I'm going to give him a little more flexion and a little bit more rotation. Better, same, worse, or gone? It's gone. So let's look at what I really have him in. I have him in flexion, right? I have him in adduction, but by the way I'm gripping him, I also have him in some internal rotation. And we're going to hold this position for 90 seconds. Now, Bob's in great shape. We know that. But not everybody can handle this long stretch, especially on the back of their knee. So it's sometimes a great idea to hold at the back of the knee and you can just slightly bend the knee. Go ahead and let go, Bob. Let me have it. And sometimes that is better for some patients. So it doesn't matter. You still are going to have the same position that you're holding for 90 seconds. Okay, after 90 seconds, we're going to put his leg down very gently. Let me do it, Bob, as passively as we can. And I'm just going to lay his leg down. Okay, so shake it out a little bit. There we go. Now look where his foot placement is. Look at how that changed. That is such a very easy position to do, and it can make such a difference in people that turn their foot out when they walk, which makes them balance on their hip wrong and on their knee incorrectly and can cause more problems even in the upper structure. Structural relief therapy is a tool that you need to add to your toolbox, and I really hope I see you at a class soon. Thank you.